So chelation therapy is an IV therapy to remove heavy metals from the body. We accumulate heavy metals through many of our daily activities, most commonly through certain foods. People that smoke accumulate heavy metals. Dental amalgams, seafood are all possible sources of heavy metals. Heavy metals can cause inflammation and can be catalysts to the disease process. So the process of chelation therapy is an IV solution based in saline, including vitamin C and B vitamins, that includes EDTA, and that stands for ethylene diamine tetraacetic acid. It's a synthetic amino acid that grabs onto heavy metals and does not let go of them. When the EDTA is filtered through the kidneys, the EDTA and the heavy metals get filtrated out and come out in the urine. So what the IV chelation does essentially is detox the body from heavy metals. The word chelation actually is from the Greek word chele, or claw, and it grabs onto heavy metals like a claw and does not let go. And then when they're filtered in the natural process that the kidney does, these heavy metals and the EDTA gets filtered through the body and excreted in the urine, getting rid of the heavy metals. So chelation therapy is both a preventative measure and a treatment for heavy metal toxicity. Some people present with acute toxicity due to some sort of poisonous exposure through seafood or dental amalgams or anything in their environment, and removing the heavy metals can really improve their quality of life. Many people present with mild levels of toxicity of heavy metals and come in for the preventative nature of removing heavy metals so that they do not develop a disease or inflammatory process in the future. So the most common forms of heavy metal toxicity are from the most poisonous forms of metals, which are lead and mercury. And they're in our environment. They're in lead-based gasoline. Mercury is in dental amalgams. Mercury is in certain seafood. And both of these chemicals can cause chronic issues and acute poisoning if the levels are high enough. If you feel you've been exposed to heavy metals, they can be checked through both blood tests and urine tests and even hair samples. When we check our patients and find chronic illnesses and we can't find any other reason, one of the things we look at is toxicity, and heavy metals is one of those sources of toxicity. Toxicity is often the cause when people cannot figure out what's going on with their health, whether it's simple acne or rashes or skin irritation or just fatigue or brain fog. Toxicity is just another name for the body being poisoned. And if we can pull poisons out, which is what chelation therapy does, the symptoms associated with that poisoning will go away. Chelation therapy is often a last resort for many patients when they've been to many other medical doctors and checked their metabolism and checked all of the issues that traditional doctors check, and they say, well, there's nothing wrong with you, it must be in your head. Most doctors do not check for heavy metal toxicity. We find in patients where their lead or mercury or other heavy metals are elevated, they just don't feel like they have the energy or the brain sharpness or the ability to function at their peak levels. By pulling out heavy metals, you're literally pulling out a poison and allowing the body to function at a higher level.